Today, the Scottish Conservatives launched their drugs strategy. I'm pleased they're considering their position, but I have to say I'm less than impressed with their deliberations. Drug-related harm is a terrible blight on Scotland, the UK and beyond. Any death from drug consumption is regrettable, and all actions that can prevent further deaths must be explored. Drug policy reform is of the utmost importance, and politicians should engage with drug users, support workers, medical professionals and the law enforcement agencies at every opportunity. It is, however, a much broader subject than the deaths due to heroin and or methadone. My concerns with the Scottish Conservative strategy is that it's full of good intention but lacks any bold ideas. While it seems content to push the provision of more support onto the broad shoulders of the third sector and pharmacists, it doesn't once mention heroin addiction treatment units, safe drug consumption rooms, or drug testing facilities such as those provided by Loop. HAT units and safe drug consumption rooms help to create the environment where users can address housing, access to work and support, so these goals can become a reality. The report talks about the need for housing, access to work, community support plans, but at the same time, not once does it mention poverty or how they will fund their changes. They talk about diversion, where their colleagues at Westminster are trying to reschedule Spice and Mamba to make it easier to arrest people and hand down heavier sentences. These two policies directly oppose each other. The report also bemoans the loss of the needle exchange in Glasgow Central Station, and I would agree, but needle exchanges lead to detritus in the local area and can't prevent overdoses. Safe drug consumption rooms eliminate the drug paraphernalia being discarded and provide naloxone to prevent deaths from heroin or other opioid overdoses. They have been tried and tested successfully in Spain, Switzerland, Germany, Canada, Australia and many, many more countries. Safe drug consumption rooms dramatically reduce the spread of HIV and hepatitis C. There has never been a death due to an overdose in any safe drug consumption room in any country in the world. So if we want to get serious and address this problem, if we want to drive down the number of deaths, then action is required. And while I genuinely welcome the Scottish Conservatives' interest in this issue, if they want to help, they should start by asking their colleagues at Westminster to allow a safe drug consumption room to be established in Glasgow. Then we can engage with problematic users and reduce drug deaths. Establishing a safe drug consumption room is only one step, but it would be a much needed positive action.